ArmadaHealth is different. Listen, there is a lot of noise and hype out there with data transparency and quality programs, and I'll make it really simple. Anybody who's telling you that they're a big data solution, they have 5 billion data points, and that's all they need, is lying to you. You know, I can go to these data only sites, and you can go too. Look me up. And when you look me up, it looks like I'm the most amazing endocrinologist out there, despite the fact I haven't practiced in 15 years. And the reality behind that is that we all know that healthcare data is messy, and it requires not just the data, but the data scientists to make sense of it, the clinicians to help the data science make sense of it, to train, and the clinicians that are needed to train the data science models, to look at the data science model outputs. It requires a ton of work. So these pop-up startups that, you know, think that because they're getting 5 billion data points from CMS can all of a sudden be a thought leader in data quality, it's just not true. And then you also see others in the space that are relying solely on reputation. And we know that these centers of excellence reputations are getting diluted as we see trends like them lending their brand to affiliations. And so what Armada does is different. We take an approach that we like to call high-tech right touch. So, yep, we get all that data as well, but we get data outside of just the administrative claims databases. We want to know more about just the 30, 60, 90-day post-op complications. We want to know more about who that physician is as a human. And so we go broad and deep into other data sources. We also have invested very heavily in our team of humans. This is this right touch, you know, on the internal side, that are physicians, clinicians, you know, researchers, that help make sense of the data, that help create the algorithms and the rules, and then follow outcomes long term to see what happens. That's a difference too, the fact that we add that in there. And then last, you know, we have these navigators that many of them have been doing this work for over 12 years, and they're able to get information from members or patients that you can only elicit from a conversation or that human touch. And those learnings that we gather from the navigators, we bring that back and put it back into our system. So this is again where this kind of right touch piece is so important. And then lastly, the patient, like, how did they do? What was their experience? Not just with us, but with the physician and the physician's office. We capture those patient-reported experience measures and put it back into our knowledge base. And we also capture their outcomes. How did you do clinically? You know, 30 days, 60 days, a year later, tell us. And those patient-reported outcome measures have often been shown to demonstrate or correlate better with clinical outcomes than administrative claims database data. So we take all of this and bring it in through this high-tech right touch approach that I think differentiates us from the folks who are siloed in data only or AI only or reputation only. So that's, yeah, I think that's why we're different.